Have you ever felt that as a Muslim woman, there are not enough Islamic programs out there dedicated to just you? Have you ever had questions run through your mind about your role as a Muslim woman, your rights and responsibilities, or just general matters? Just Us Women is a program dedicated to you, the Muslim woman. Islam Life Radio has tailored Just Us Women to meet the needs of our Muslim sisters in order for them to gain authentic knowledge. Our host and teacher for this program, Ummu Maahir Ismaa'eel, will deliver and expand your minds on various topics related to women's fiqh, motivational talks, and how to be among the best women to earn Allah Azza wa Jal's pleasure in this life and the next, inshaAllah. So be sure to join us every Thursday at 7 p.m. Eastern Standard Time with Just Us Women, brought to you by IslamLifeRadio.com.
Provocative. Education coming full circle. From the author of Muhammad's Role in Islam, 50 Concepts Brought by Muhammad, Holy Wars, Crusades, Jihad, Biography and Mission of Muhammad ibn Abdul Wahhab, is the host and author Jalal Abu al-Rub. Provocative challenges false perceptions and misconceptions about Islam, the Quran, Muhammad, and Islamic law. Not intimidated and unafraid to answer all questions about Islam according to Allah's book and Islam's messenger. Tune in to listen and or engage the host with hopes, doubts, criticism, or fears as we bring your Islamic education full circle by spreading the truth of what Allah has ordained on His creation. Provocative. Education coming full circle.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Are you experiencing a difficult situation? Going through stress, anxiety, confusion, or even depression? Perhaps something's troubling you and you don't know who to ask and where. Maybe you've done a sin and you don't know how to deal with it to make everything better and redeem yourself. You might even be wanting to consider marriage and have someone in mind, but don't know how to take the matter forward in a halal way. Are you looking for advice and guidance, which is also Islamically sound and authentic? If so, then your prayers have been answered. Islam Life Radio is now offering a free, confidential, anonymous, impartial, and non-judgmental counseling service based on the Quran and authentic Sunnah. Email us now at counseling@islamliferadio.com.
Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. Sallallahu ala nabiyyina Muhammad wa ala sahbihi wa sallam. Welcome back, dear sisters. Today we are continuing our discussion on childbirth in Islam, prenatal and beyond. If you haven't had the opportunity to listen to the first segment, it has been annexed to the series on marriage in Islam under the title Fiqh of Zawaaj, the Fiqh of Marriage, Part 9, Childbirth in Islam, Prenatal and Beyond. In that segment, we presented the blessing of bringing children into the world, the virtue of pregnancy, the miraculous development of the embryo, medical treatment, ultrasounds in determining the sex of the embryo, cravings, incontinence and secretions during pregnancy, bleeding during pregnancy, how to handle difficulty in praying, cultivating your infant's spiritual development while in the womb. Today, we continue prenatal care and then labor bi'idhnillah. Unlike the Christian faith that teaches that humans are sent to earth handicapped with the burden of the sin of others, Allah makes it clear that each human is responsible for his or her own record of deeds. Thus, the slaves that come to earth are sent on an even playing field, prepared to fulfill the covenant taken with Allah. It is therefore our responsibility as the vessels that these slaves are delivered through to bring them to earth in strong jism, the term jism referring to body, and intellect, so that they are able to meet the challenges ahead of them. And to that end, expecting mothers are responsible to nourish the child that they are carrying with the best diet they can obtain. Eating healthy foods is more important than ever at this time. While there isn't anything in Islam that dictates a particular diet, Islam does stress a wholesome, healthy diet in general. And this is the time for young mothers who may have gotten comfortable with a fast food diet to become reacquainted with the vegetables that you didn't fancy as a kid. You need more protein, iron, calcium, and folic acid than you did before pregnancy. It is important to get enough protein throughout your entire pregnancy. And it is even more important during the second and third trimesters when your infant is growing the fastest. Seafood is a great source of protein. Research has shown that eating fish and shellfish regularly is beneficial to our bodies in many ways. Seafood is a high protein, low fat. So again, seafood is a high protein, low fat food that provides a number of health benefits. It is an ideal addition to the diet of the expecting mother. White flesh fish in particular is lower in fat than any other source of animal protein, and oily fish are high in omega-3 fatty acids, or the good fats. Since the human body can't make sufficient amounts of these essential nutrients, fish are an important part of the diet. So some may ask, what types of fish or other seafood are permissible? There is a misnomer that it is impermissible for Muslims to eat shellfish, crabs, shrimp, etc. On the contrary, in Surah Al-Ma'idah, Allah states that it has been interpreted, lawful to you is the pursuit of water game and its use for food, for the benefit of yourselves and those who travel. Ibn Kathir rahimahullah commented and documented that Ibn Abbas said, Sayyiduhu, literally meaning hunting or pursuit, refers to whatever is taken from it alive, meaning water, and ta'amahu, which literally means food, means whatever is taken dead. In addition to this, Abu Hurairah radiallahu anhu said, a man asked Allah's messenger, "O Allah's messenger, we go to sea and carry little water with us. If we use it for wudu, we get thirsty. So should we use seawater for wudu?" And he responded, its water is purifying and it's dead, meaning the sea animals are lawful to eat. Again, he said, its water is purifying and its dead are lawful, meaning lawful to eat. So this clarifies the position of Islam on eating shellfish. It is permissible to eat crabs, shrimp, and other shellfish, so enjoy. Dear sisters, you want to make sure that you're getting your daily supplements. Most prenatal protocols include prenatal vitamins specifically designed to fill any nutritional void in the mother's diet. As I mentioned earlier, folic acid, iron, iodine, and calcium are especially important to sound growth of the developing embryo. Folic acid helps prevent neural tube birth defects, which affect the brain and spinal cord. And by the way, your infant is in need of folic acid very early in the pregnancy. So it's actually a good idea to take a good supplement that contains folic acid even before pregnancy. Another essential supplement that is not being talked about as much as it should be is vitamin D3. It is now becoming apparent that high doses of vitamin D3 may cut pregnancy risk. In an article written by Salin Boyles, which appeared in WebMed Health News, it was stated, women who take high doses of vitamin D during pregnancy have a greatly reduced risk of complications, including gestational diabetes, preterm birth, and infection. Also, it was stated researchers are recommending that pregnant women take 4,000 international units or IUs of vitamin D every day, at least 10 times the amount recommended by various health groups. And co-researcher Carol L. Wagner, MD of the Medical University of South Carolina, acknowledged that the recommendations may be controversial because very high doses of vitamin D have long been believed to cause birth defects. She stated, any doctor who hasn't followed the literature may be wary of telling their patients to take 4,000 IUs of vitamin D. But there is no evidence that vitamin D supplementation is toxic even at levels above 10,000 IUs. So in their studies, they found women taking 4,000 IUs had the lowest rate of pregnancy-related complications. Compared to women who took 400 IUs of vitamin D daily, they were half as likely to develop gestational diabetes, pregnancy-related high blood pressure, or preeclampsia. Wagner says they were also likely to give birth prematurely. So supplementing with vitamin D3 is essential to Muslim women because we cover in our hijab when going out of the house, and therefore we are cutting off the source of vitamin D3, namely the sun. The rays of the sun are absorbed through the skin, which in turn produces the vitamin D3 that our bodies need to properly function. Again, the rays of the sun are absorbed through the skin, which in turn produces vitamin D3 that our bodies need to properly function. A high blood pressure and high blood sugar are common among expecting Muslimat, among other complications, which could be alleviated by supplementing with this essential nutrient. So remember, sisters, to supplement with your prenatal vitamins and at least 4,000 IUs of vitamin D3. How about dates? Is it recommended that the pregnant woman in particular eat dates? There are a number of unauthentic narrations recommending pregnant women eat dates attributed to the Prophet sallallahu alaihi wasallam, and among them is one attributed to Ali ibn Abi Talib, in which he was supposed to have related the Messenger of Allah sallallahu alaihi wasallam said, "Feed your pregnant women fresh dates. If there are no fresh dates, then dry dates. For there is no tree that is dearer to Allah than a tree beneath which Maryam bint Imran stayed." Ibn Kathir rahimahullah considered this a very odd hadith, a very odd hadith. So please, if you're coming in late on this, just keep in mind that what I read to you was not an authentic hadith, so please be careful. And with that stated, it has been mentioned that eating fresh dates are highly recommended for women during the early generations. Ibn Abi Shayba narrated that with a sahih isnad, that Ibn an-Nakhai said they used to recommend fresh dates for women in nifas. Al-Fadl ibn Daki narrated in his book As-Salah that Rabi' ibn Khuthayn said, "In my view, there is no remedy for women in nifas like fresh dates." And you can follow up with that more in Fath al-Bari by Ibn Hajar rahimahullah. Sisters, from a scientific point of view, studies have found medjool dates are a great source of potassium, the mineral that protects the heart from keeping sodium levels in check and prevents high blood pressure. A 1 cup serving of dates contains up to 3 times as much potassium as a 1 cup serving of bananas. They are an excellent source of dietary fiber, which supports the digestive system and provides a sense of fullness, which should help curb the appetite. They are also plentiful in the B complex vitamins and minerals like magnesium and iron. And if you are constipated, try some dates. The dietary fiber in dates helps to move waste smoothly through your colon. To relieve constipation, just immerse a handful of dates, maybe 5 to 6, in water at night and make a syrup the next morning and drink it. Let's take a look at honey. Scientific research is now documenting how much healing power is actually found in honey. However, this is secondary to Allah's statement in Surah An-Nahl when he stated, as it is interpreted, "And thy Lord taught the bee to build its cells in hills, on trees, and in men's habitations. Their issues from within their bodies, a drink of varying colors, wherein is healing for mankind. Verily, in this is a sign for those who give thought." And from the lips of our blessed Prophet, sallallahu alaihi wasallam, we find honey is a remedy for every illness, and the Quran is a remedy for all illness of the mind. Therefore, I recommend you both remedies, the Quran and honey. And this hadith can be found documented by Imam Bukhari. The Prophet alayhi salam has also informed us of the healing found within honey for a variety of medical issues, particularly stomach ailments. Imam al-Bukhari documented the case of a man who came to the Prophet sallallahu alaihi wasallam because his brother had a stomach disorder. The Prophet alayhi salam said, "Let him drink honey." The man returned a second time complaining that no improvement had happened in his brother's case. And again, the Prophet ﷺ responded, "Let him drink honey." The man returned again and said, "I have done that, but to no avail." Thereupon the Prophet ﷺ responded, "Allah has said the truth, but your brother's stomach has told a lie. Let him drink honey." He drank it and was cured. So a benefit from this hadith is that there should be patience in the treatment, in the protocol that has been given to us through the Sunnah, or in particular, a lot of times we'll read these things, the medicine of the Prophet and the remedies that are there, and we might not have the confidence that we should have in that protocol. If it came from Allah and His Messenger, then it is a healing for us. And what it's going to take on our part is confidence, belief, and patience. It is now documented that honey contains antibacterial, and antifungal properties, antidiarrheal, wound healing, and anti-inflammatory properties, anti-tussive and expectorant properties, as well as nutritional value. But is it safe to eat honey during pregnancy? Dr. Matthew Beshara said that he is often asked, is it safe to eat honey during pregnancy? And he responded, there's nothing in the literature that says you can't eat honey during pregnancy. The spores in honey are not going to affect the fetus. So I would say honey is safe to eat. I do usually tell my patients to avoid anything unpasteurized, though, only because I feel that it is not worth taking a chance. I recommend avoiding unpasteurized honey, just as I would recommend avoiding unpasteurized cheese while you're pregnant. The medical community warns against giving honey to infants below the age of 12 months for the fear of infant botulism. And this is what the doctor was referring to when he mentioned the term spores. And that's where the question arises regarding pregnant women eating honey because of this issue of botulism. But what is infant botulism? Botulism spores are found widely in soil, dust, and honey. Adults who swallow this botulinum spores are almost never affected. When infants swallow the spores, however, the spores can germinate in their immature gastrointestinal tracts and begin producing botulinum toxin. And this has occurred even when the honey was only used to sweeten a pacifier. Again, he states that this has occurred even when the honey was only used to sweeten a pacifier. And that was found in the European Journal of Epidemiology. So botulinum toxin is the most poisonous natural substance known to man. The lethal dose is invisible to the naked eye. This tiny amount in the bloodstream can cause death within minutes through paralysis of the muscles used in breathing. So we see why the medical community warns against feeding infants below the age of 1 honey. And certainly Allah knows best about the issue, since Muslims have been using honey for thousands of years. However, again, that is concerning infants, not the expected mother. Honey has been used for centuries for healing and rejuvenation. The rejuvenating properties are a wonder for an exhausted mom-to-be. In its natural raw state, honey contains many enzymes that can help some people digest food more easily, so that it may also help treat ulcers and diarrhea. Honey has been proven to decrease the cancer-producing effects of many carcinogens and to be effective in eradicating yeast. And that's a very important point, considering that some scientists today are saying that actually this is where cancer might begin, with the issues of yeast and so forth. The nutrient content of raw honey can contain small amounts of folate, as well as vitamin B2, C, B6, B5, and B3. Minerals including calcium, copper, iodine, iron, magnesium, manganese, phosphorus, potassium, selenium, sodium, and zinc can also be found in raw honey in small amounts. So needless to say, eating honey regularly is very beneficial for the expectant mother. And now that we've talked about the need to eat more and better, let's look at overeating. While pregnant, it's only natural that your appetite increases. And after all, you are eating for two, as they say. However, sisters, be careful of overeating, as that can not only affect your health, but your emphasis as well. Eating too much when pregnant can lead to excess weight gain, which not only affects your health, but will put a strain on your prayer because of the increasing back and leg pain. Overeating and excess weight gain also increase your risk of developing gestational diabetes, because your body is not able to make or use insulin properly, leading to elevated blood sugars. And this can eventually lead to type 2 diabetes if left unchecked. So with that in mind, we see that following the Prophet's guidance regarding diet is very beneficial. Our blessed Prophet, sallallahu alaihi wasallam, used to eat only enough to keep him strong. He did not eat so much that it caused him to become overweight. It was documented that he, alayhi salam, said, the believer eats in one stomach, while the non-Muslim eats in 7. He also said, the son of Adam does not fill any vessel more than his stomach. It is sufficient for the son of Adam to eat a few mouthfuls to keep him going. If he must do that, meaning fill his stomach, then let him fill it 1/3 with food, 1/3 with drink, and 1/3 with air. Dear sisters, eating this fashion undoubtedly will cause the pregnant woman to be more comfortable, and it will protect her from diseases and health issues caused by overeating. And it's interesting to note here that doctors now, the medical community now, is actually advising diabetics to eat smaller portions. Now, isn't that something? And the Prophet ﷺ said this 1400 years ago, like a lot of things that he said that they are only now discovering today. Alhamdulillah. And let's be honest about cigarette smoking. While the debate rages, cigarette smoking has become widespread in the Muslim world. La hawla wa la quwwata illa billah. However, studies have proven that cigarette smoking is one of the major causes of lung cancer and other diseases. It is also one of the major causes of death worldwide. I sincerely say to the sister who is still engaging in this dangerous habit, if your health isn't enough to make you quit smoking, then the health of your baby should be. Fear Allah. According to an article published by WebMed, the nicotine, meaning the addictive substance in cigarettes, carbon monoxide, and numerous other poisons you inhale from a cigarette are carried through your bloodstream and go directly into your baby. And it went on to say, smoking while pregnant will lower the amount of oxygen available to you and your growing baby, increase your baby's heart rate, increase the chances of miscarriage and stillbirth, increase the rate that your baby is born prematurely and or born with low birth weight, increase your baby's risk of developing respiratory or lung problems, increases the risk of birth defects, increases the risk of sudden infant death syndrome. Dear smoking sister, the more cigarettes you smoke per day, the greater your baby's chances are of developing these and other health problems. There is no safe level of smoking while pregnant. And as far as secondhand smoke is concerned, if you are exposed to someone else's cigarette smoke, perhaps your spouse or another family member smokes, then this is even more dangerous than you smoking yourself. The article stated, if you are regularly exposed to secondhand smoke while pregnant, you will have an increased chance of having a miscarriage, stillbirth, tubal pregnancy, low birth weight baby, and other complications of pregnancy. Dear sisters, it is well known that the Sharia prohibits everything that is harmful to the human being. Allah states, as it is interpreted in English, do not kill yourself. Allah is merciful unto you. And our blessed Prophet ﷺ followed up by saying, there is no harm or causing of harm. And he ﷺ also stated, your body has a right on you. So dear sisters, if your own body has a right upon you, then what about the defenseless infant being carried in your womb? Let's now turn to keeping cats in the home. It is well known that Muslims favor cats and keep them in the home. There is no harm in this, as we find in the following narration that mentions not only can we keep cats, but we can eat after them as well. It was documented in the Sunan of Abi Dawood and elsewhere that a woman brought some harissa, which is a type of food, to our mother Aisha radiallahu anha, and found her praying. Aisha gestured to her that she should put it down, and then a cat came and ate some of it. When Aisha had finished praying, she ate from where the cat had eaten, and said, the Messenger of Allah sallallahu alaihi wasallam said, they, meaning cats, are not najis, meaning impure, rather they are among those who go around among you. And I saw the Messenger of Allah alayhi salam doing wudu with water from which a cat had drunk. So we find that there is no harm in eating or drinking behind your pet cat. Alhamdulillah. However, a pregnant woman should be careful when it comes to emptying the litter box. So for our sisters who do own cats, you may have heard that you should not change litter during your pregnancy. You may be wondering why. It has been found that changing litter puts you at risk for contracting an infection called toxoplasmosis. There are several ways that a pregnant woman could contract toxoplasmosis, but cats are known to be common carriers of the infection. Pregnant women are advised to not change litter if at all possible. What is toxoplasmosis? Toxoplasmosis, caused by the parasite Toxoplasma gondii, is generally a mild infection with flu-like symptoms. Many adults have the infection and never even realize it. If you have been infected with toxoplasmosis prior to getting pregnant, you have probably developed immunity to it. Toxoplasmosis is only a danger to your baby if you have an active infection during your pregnancy. Consequently, if you have had it before getting pregnant, you will most likely not develop the infection again. Cats are carriers of the parasite that causes toxoplasmosis. The parasite lives inside the cat's intestines and is passed into their feces. It is more commonly found in cats that are allowed outside that might eat contaminated rats or mice. Changing cat litter may expose you to the parasite that causes toxoplasmosis and is also found in raw meats and unwashed root vegetables. So if a woman is infected with toxoplasmosis during her pregnancy, her baby is at risk of being infected as well. About 40% of babies of mothers infected with toxoplasmosis during pregnancy will also be infected. The effects of the toxoplasmosis are mild to the mother, but may cause miscarriage, congenital defects, damage to the eyes, brain, or other problems. Many doctors screen women during their prenatal visit for this infection, but it is not always routinely done. If you own a cat or are concerned about having the infection, talk to your healthcare provider about your concerns. So if you have to change cat litter, sisters, during your pregnancy, it is best to have someone else change this litter for you, first and foremost. Try to have someone else do it for you. And if you do not have someone else to help you with this, or you find yourself faced with having to change your cat's litter box, then use gloves and a mask and wash your hands thoroughly with soap and water when you are done. It was mentioned that changing cat litter daily may help to cut down your chances of being infected. So, again, if you don't, get somebody else to change the litter. Take the precaution. For certain, there's no harm in that. Now, other ways of avoiding toxoplasmosis during pregnancy includes, again, the handling, or being careful how we, handle, soil, dirt, or, contaminate, or raw meat. So toxoplasmosis can also be contracted from soil that has been contaminated or from eating or handling raw meat. So if you are a gardener, or you're going to touch dirt or soil, it is safer for you to wear protective gloves and wash your hands with soap and water when you are done. And while cooking, sisters, remember to wash your hands with soap and water after handling meat. Be sure to wipe down any counters, any of your kitchen counters, your utensils, handles that you might have touched with a disinfectant. Now we turn to the labor process. Labor is the process in which the fetus and the placenta leave the uterus. Delivery can occur in two ways, vaginally or by cesarean delivery. Labor occurs in 3 stages and can actually begin weeks before a woman delivers her infant. The first stage begins with the woman's first contractions and continues until she is dilated fully, which is usually 10 centimeters or 4 inches. Which means that the cervix has stretched to prepare for birth. The second stage is the active stage, in which the pregnant woman begins to push downward. It begins with complete dilation of the cervix and ends with the actual birth. The third stage, or placental stage, begins with the birth and ends with the completed delivery of the placenta and after birth. As mentioned, the labor process is marked by contractions that push the infant out of the womb. And in most cases, this can be a very painful process. This brings about several implications for the Muslimah. First and foremost is dealing with the pain of labor and how it impacts the most important act of our worship, which is our prayer. Sheikh Uthaymeen was asked the following question. My wife used to pray regularly until the first child. And after that, she became quite lazy, claiming that a woman's sins are all forgiven due to the pain she faces during labor. What do you say to her? The Sheikh responded, Rahimullah, this is not true. If the woman, like other humans, faces some hardship and she is patient and hopes for reward for that, she will be rewarded due to that pain and affliction. In fact, the Prophet ﷺ gave examples of lesser types of pain which expiate sins, such as being pricked by a thorn. Know that if a person has patience and expects reward from Allah for anything that has afflicted him, he will be rewarded according to what he has of patience and expectations. The essence of affliction is the removal of his sins. The one who is afflicted has his sins removed under any circumstance. Furthermore, if this is accompanied with patience, the person will also be rewarded for his patience with his affliction. When a woman gives birth, there is no doubt that she suffers a lot of pain and hardship. The pain removes some of her sins. Again, that pain removes some of her sins from her. It is also, if she is also patient and expecting a reward from Allah, then in addition to having sins removed, she will also be rewarded and have good deeds recorded for her. And Sheikh Ibn Jabreen was asked, is it allowed for me to pray while I feel labor pains? And his response was, the woman prays whenever she is free of menstruation and postpartum bleeding. However, if you see blood a day or two before giving birth, that blood is considered postpartum bleeding. Therefore, do not pray. On the other hand, if you do not see any blood, then you continue praying even if you are having labor pains. In the same way that an ill person prays while feeling the pangs of his illness, and he still has to pray as long as he is conscious. So that brings us to, when does a woman stop praying during labor? A woman ceases praying under two conditions. She is experiencing haid, menstruation, or nifas, and that's the blood of childbirth. Bleeding, which occurs 2 or 3 days prior to childbirth, can be ruled as nifas if it is accompanied by contractions, a sign of childbirth. Shaykh al-Islam Ibn Taymiyyah said, rahimahullah, he said, with regard to that blood, which is seen 2 or 3 days before delivery, it is nifas because it is blood that comes out because of giving birth. So it is nifas, just like blood that comes out afterwards. This is because pregnant women rarely see blood. But if a pregnant woman sees blood close to the time of delivery, it is obviously because of birth, especially if she is having contractions. And Sheikh Mansour al-Bahuti, rahimahullah, stated in Kashaf al-Qanat, if she sees blood 3 days or less before the child is born, accompanied by signs such as pain, then this is nifas, like that which comes out at the time of birth. That which comes before the birth is not regarded as a part of the period of nifas. And Sheikh Muhammad ibn Salih al-Uthaymeen, rahimahullah, also connected contractions with blood emitted during labor with nifas. In Al-Bab al-Maftuh, he stated, the scholars say that nifas is the blood which appears at the time of childbirth, accompanied by contractions. If the contractions come 1 or 2 days before the birth, then this is nifas. As for bleeding, which occurs without contractions, it is not nifas, even if that occurs on the day that she gives birth. When the bleeding of nifas stops sometime after giving birth, then when she becomes pure, she must purify herself and start to pray. And she should not wait for that time to be completed. And another scenario posed to Sheikh al-Uthaymeen, rahimahullah, we find if a woman whose pregnancy has reached full term passes blood and has pains, but she does not know whether these are the contractions that will lead to childbirth or contractions that will later ease off, should she pray or not? And he responded, his response was, of course, there are 2 things we may assume here. The first is that the pregnancy will continue without contractions. The second is that the apparent case is that these are contractions, so she should stop praying. And if this is what usually happens to her, and she may carry on having contractions for 4 or 5 days without giving birth, then in this case, she should still pray. And then he was asked, if she acts upon the second assumption, and then the contractions ease off, should we tell her to make up the prayers that she has missed? And he responded, it is preferable to make them up because she made her decision on the basis of an assumption. And from this we understand that if a woman normally has contractions for a number of days, she is not experiencing nifas and she must pray. However, if that is not normally the case, we assume that it is nifas and she should stop praying. And if she has ceased praying, and it turns out that she was not experiencing nifas after all, she should make up any missed prayers, and Allahu A'lam. So now that it's clear that the woman in labor is still responsible to pray to the best of her ability, be reminded that if she missed any prayers, again, for any reason other than the blood that may mark the time of delivery, she must make up those prayers once her postnatal bleeding has subsided. So now let's look at making the labor easier. Sheikh Muhammad ibn Salih al-Uthaymeen, rahimahullah, was asked, are there any verses that may be recited for the purpose of making childbirth easier for the woman? And he replied, I do not know of anything of that nature in the Sunnah, but if you recite over the pregnant woman who is in labor that which speaks of things being made easier, such as the verse as it is interpreted, Allah intends for you ease, and He does not want to make things difficult for you. And that which speaks of childbirth and delivery, such as the verse, and no female conceives or gives birth but with His knowledge. This will be beneficial. It has been tried and tested by Allah's leave. He went on to say that the entire Quran is healing. If the reciter and the one to whom it is recited believe in its impact, then it must inevitably have an effect. Because Allah subhanahu wa ta'ala says, and we send down from the Quran that which is a healing and a mercy to those who believe, meaning in Islamic monotheism, and act upon it, and increase the zalimun, the polytheists and the wrongdoers, nothing but loss. So he said this verse is general in meaning, healing and mercy. It includes healing of hearts from the diseases of doubt and desire, as well as the healing of bodies from physical disease. Let's now look at medications that reduce pain. There is nothing wrong with using these things, these medications that reduce pain in childbirth or even prevent it altogether. Sheikh Uthaymeen, again, he was asked, a woman is saying that she is physically weak and she gave birth to a child with difficulty. They gave her some fluid saying that it would induce labor as her contractions were weak. But with this induced labor, she says that she felt as if, quote, as if I had lost my mind. And she was very weak after the birth. That weakness lasted for almost a year. She says that she got pregnant after that with her second child. And some people advised her to go to a special hospital where they gave her an anesthetic by injection because she could not bear the induced labor. She also says that after they gave me the anesthetic, I did not feel the pain of childbirth and slept a little. Is this permissible, O Sheikh? She says that she is 3 months pregnant. I hope that you can advise us. We ask Allah to reward you with good, because some people have told me that this is not permissible. Now, the Shaykh, rahimahullah, responded by saying, if the pains of childbirth are too difficult for a woman and she takes some permissible medicines to help her cope with that, then there is nothing wrong with that. And it comes under the heading of enjoying the blessings of Allah. Allah, in His kindness, generosity, and grace, likes His slaves to enjoy the blessings that He has bestowed upon them. And He likes to see the effects of His blessing on His slave. Using these medicines in labor and the like is something that is permissible, and there is nothing wrong with that, because Allah likes ease for His slaves. As Allah says, Allah intends for you ease, and He does not want to make things difficult for you. A word about the cesarean section, or the C-section as we call it. Sheikh Uthaymeen, rahimahullah, was asked, I would like to take this opportunity to point out a phenomena that has been mentioned to us, which is that Many obstetricians, male and female, in the hospitals are too keen for birth to take place by surgical means, which is known as a cesarean. I am afraid that this may be a plot against the Muslims, because the more births that take place in this manner, the more the skin of the abdomen is weakened, and pregnancy becomes more dangerous for the woman, and she becomes unable to get pregnant. Some of the people who work in private hospitals have told me that many women come to the hospitals and their specialists tell them that there is no alternative to a cesarean. Then they go to this private hospital and give birth naturally. He mentioned that there were about 80 such cases in 1 month. This means that the issue is serious and attention must be drawn to it. It should be noted that in this case, some pain and exhaustion is inevitable. And then he brought the quote, his mother bears him in hardship, and she brings him forth with hardship. It is not something to be done as soon as the woman feels a contraction, so that she may avoid pain. He concluded by saying natural childbirth is better than a cesarean section. And I remember a sister who was from Morocco telling me that a lot of women in Morocco schedule cesarean sections. They don't even want to go through the birthing process at all. And so they schedule their cesarean straight off the bat. They go get their hair done, they get their makeup done, and they go to the hospital to have a cesarean. Sister, this is not something that should be done. We should avoid that. As the Sheikh said, natural childbirth is better than a cesarean. And the Sheikh was also asked, stated, Allah says in Surah Al-Abasa, then he makes the path easy for him, and that again is an interpretation. Then he makes the path easy for him. So Allah guarantees to make it easy for this newborn. Many men and women have noticed that there is haste in performing cesarean sections. Is this a sign of weak trust in Allah? And so he answered, I think that this method, which people use nowadays when the woman feels the contraction and goes to the hospital, and they do a cesarean section for her, I think that this is inspired by the shaitan, he says. I think that this is inspired by the shaitan, and that the harm caused is far greater than any benefits, because a woman is bound to feel pain when in labor, but this pain has a number of benefits. And then the benefits he mentioned were, number one, an expiation for sin. 2, it raises her in status if she is patient and seeks reward. 3, the woman understands the extent of the pain suffered by other mothers. 4, she will appreciate the extent of the blessings of good health that Allah bestows upon her. Next, it will increase her love towards her child, because the more difficult it is to attain something, the dearer it becomes. He also mentioned that if the child is born via the usual well-known route, this is better for him and the woman, he said. Next, he mentioned damage may be expected from this surgery because this operation weakens the walls of the uterus, etc., which may tear, and it may be successful or unsuccessful. Next, the woman who gets used to having cesareans is unlikely to give birth in the natural manner, because that is not possible. And there is the risk that the site of the surgery may rupture. And then having surgery results in having fewer children, because if the abdomen is cut 3 times in different places, it becomes weak and future pregnancies become dangerous. And finally, he said, this is a kind of luxury, and luxury is a thing that leads to doom, as Allah states, as it is interpreted in Al-Waqiyah, verily before that they indulged in luxury. So women should be patient and seek reward, and should continue to give birth in the natural way, because that is better for them in this world and in the hereafter. Men should also pay attention to this issue, for we do not know, perhaps our enemies are the ones who have made these operations easy for us, so that we will lose these benefits and be subject to these losses. So then the question arose, what is meant by luxury? The answer, the response, luxury includes avoiding the natural pain of childbirth. Again, luxury includes avoiding the natural pain of childbirth. This is a kind of luxury. If luxury does not help one to obey Allah, then it is either blameworthy or at the very least permissible. So let's look at some other issues here. Who should be in the delivery room? We want to be careful of who is in the delivery room. We know that in the West, you know, they're doing all kinds of things in the delivery rooms these days. We don't want to follow these practices. The woman who is laboring is not properly covered, and chances are her aura is exposed. It is permissible for the husband to assist in the birthing process. Her mother could as well, or even her sister. Care should be taken to avoid glancing at the private area that the infant is exiting from. In the excitement of the head emerging from the womb, people in the delivery room want to get a first look. This should be avoided. Coaching and helping the mother push is a blessing, as it is assisting her in this very difficult task. However, we should still observe the etiquette of Islam as it pertains to modesty. Well, that now, in the same light, we will look at taping the event of the delivery, taping the event of the delivery is something that should be avoided altogether. Okay, so in the same light, taping the event of the delivery is something that should be avoided altogether. Now that the labor process is over, and before the etiquette of welcoming the newborn, there is a question of what should be done with the placenta. And this was this is an issue, especially for us in the West, with the placenta, and what do we do with the placenta? So let's look at disposing of the placenta. Sheikh Muhammad ibn Salih al-Uthaymeen, rahimahullah, said, what is the ruling on keeping the placenta to treat cancer and remove wrinkles from the face? So this is what he was asked. Again, what is the ruling on keeping the placenta to treat cancer and remove wrinkles from the face? And he replied, it seems that there is nothing wrong with this so long as it is proven to be beneficial. Then the question arose, does the principle that whatever is cut from a living being is dead meat or meta apply? And he responded, the meta of a human is tahir, or pure. Then he was asked, well, if it has no use, does it have to be buried, or can it be thrown anywhere? He answered, it would seem that it is similar to nails and hair. Please pay attention, sisters. He answered, it would seem that it is similar to nails and hair, meaning there is nothing wrong with either throwing it away or burying it. And then certainly Allah knows best. So looking at this, we want to be careful of the placenta. Take your placenta, unless you're in a Muslim country, it's really best to request, and we've done this with all of our children when we delivered. We simply requested placenta in the beginning before we even went through the birthing process. The hospital knew in advance that we wanted to take the placenta with us, and they're familiar with this. So they will get you a container and put the placenta in it, and then you can have your relative, the father, or your family member to bury that placenta for you, and then that will, just is a better thing. Just as you have your nails and any other part that you take from your body, as the Sheikh said, there's nothing wrong with either throwing it away or burying, the same as your hair and your nails. So be careful of your placenta and dispose of it properly. Okay, so this is what I presented for today regarding the prenatal and even the process of labor. Inshallah, in the next talk, we will look at welcoming the newborn. And if I've missed anything today, and there's a question for you, if I've missed it in this talk, please post it on the Just Us Women page on Facebook, or if that's it, or you can inbox me, or even post it to Islam Life Knowledge Radio as well. So with that stated, my dear sisters, I ask Allah to reward all of those who are tuning into this program and even our other programs that we have already presented. And I ask Allah to write it for my benefit and for the admins and the staff at Islam Life Radio. I ask Allah to make it a benefit for them as well. If I made any mistakes in what I presented, then it's for myself and Shaitan, and I ask Allah to forgive me for that. And with that sincerely stated, sisters, if you have, I ask you by the face of Allah Ta'ala that if you have in fact found something that wasn't clear about what I mentioned, or maybe it turned out to be a mistake, then bring it to me. Allow me to clarify it or to retract it, because again, we are human beings and we do make mistakes. And I ask you further that you don't take it to a third party. Ummu Maahir said this, Ummu Maahir said that, and so forth, with all of this fitna, because again, it's entertainment for the diseased hearts, and it is a cause of fitna among the Muslims. It is so sad to see women, posting how tired they are of, the whole, boycotting of this one and that one, and, you know, and they're finding, little avenues to seek knowledge, because no sooner they find a sheikh or a teacher who they feel comfortable with, this person is being warned against and boycotted and so forth. Yeah, I mean, we need to bring this to an end, sisters. We really do. We follow the major scholars first and foremost. But there are people out here, as myself and others, you know, very few women who really are teaching according to the minhaj of the Salaf, you know, the Salaf as-Salih. So, you know, try to help us out here. If we're doing wrong and we're saying something is incorrect, bring it to our attention. There's no harm in that. I welcome it once more. Subhanaka Allahumma bihamdik, ashhadu an la ilaha illa ant, astaghfiruka wa atubu ilayk. Assalamu alaikum wa rahmatullahi wa barakatuh.